Barbara Artinian's intersystem theory is relatively new, as stated in our book, our McEwen and Will's book. So, therefore, examples in nursing literature is often in practice as well as education, and it's not really been fully tested. Research studies have been used, but they also incorporate the grounded theory model. I found an article that talks about the usefulness of the intersystem theory with cosmetic nursing. It's easier to apply to cosmetic nursing because, like in the hospital, their relationship as well as the nurse-client relationship is a little bit different. There's a lot going on in the hospital. When they come in for cosmetic surgery or cosmetic procedures, it's elective. They kind of know what they want and what they have, what options that they have. So this article breaks it down. It talks about a 38-year female who came in, wanting to know about laser surgery, but didn't understand the exact background of what she was getting herself into. So it breaks it down as the intersystem model that we covered in a few slides previous talks about the assessment, which is the developmental environment. It first talks about the biological subsystem, which is the actual patient. And then it brings in the psychosocial subsystem because the patient was very self-conscious about her hair and she didn't really want to wait anymore, but she had plucked, and because plucking affects the laser surgery, then she had to wait. Spiritual was the only thing that wasn't really talked about, the spiritual aspect of the theory in this one, because it wasn't really needed. And then it goes on to talk about the situational environment, the intersystem analysis of the patient, which is the detector function or knowledge. She was not aware, the patient was not aware that she had to refrain from tweezing or waxing 6 weeks prior to this procedure. So she was also unaware that she wouldn't be able to tweeze or wax 6 weeks before, after the laser treatment. And she also frequented tanning beds, and she was unaware that she was not going to be able to do that before or after. It then moves on to the selector function, which is kind of how her attitude is about it, her values about it. She would like to be hair free, and she would like to have these treatments because she is soon getting married, but yet she doesn't really want to give up not having hair for now. And then it breaks it on down into the effector function, which is then her behaviors. She had previously tweezed a week ago, so then that was going to affect her not being able to get the laser treatment. Then the article talks about how it brings in the nurse role. It talks about the client function. This brings in the nurse, the detector function. Then she understands that educating the patient about this is going to meet optimal needs, but she can't go home with her and force her not to do this. She also understands that she must educate her about the tweezing, the waxing, and the suntan function. And then the selector function of that is she's teaching that so that the client can be active participant in her own care and make informed decisions. And also takes in her values, of the actual unawareness of that she wasn't able to do these things. Because of this, the effector function on the nurse side of this isn't applicable. Then it talks about the analysis of this. If she stops this, she stops the tweezing and the waxing, she'll be able to get the laser function. She understands all this. But then it breaks it down into like a scoring system, which talks about comprehensibility, meaningfulness, and manageability. And it gives a scoring based on the value based on the education that the patient gives and whether she's going to be able to participate in this or not. There's a few tables in the article that we chose, that was the kind of the research evidence for this that we have included in our references, and I encourage you to take a look at it because it breaks the theory down and then applies it to an actual case, which makes it a little bit easier. So I just kind of outlined that case a little bit, but if you go and look at those tables, it's going to break our theory down much easier for you.